now call upon Christina Bamia. Is at the Athens Medical School and very much involved in the Chances Consortium. Christina, please.
Thank you, Professor Hoffman. And let me start this talk by thanking the organizers of this event for inviting me here, especially Professor Michelle Williams. I'm very happy to be here and in this event in the memory of our teacher. And I will present to you the Chances, which is the third program that Elio mentioned before, the successful program about aging. Now, Chances stands for the Consortium on Health and Aging, network of cohorts in Europe and the United States. It's an EU-funded project which lasted for 5 years, from 2010 to 2015, under the coordination of Hellenic Health Foundation and specifically of Professor Paolo Boffetta. 15 partners are within Chances, and you can see that these come from all over Europe and the United States. I will very briefly mention some things about the Hellenic Health Foundation, otherwise HHF, and which will be shortly named after Dimitrios Trichopoulos, is a non-profit organization in Athens, established in 2006 by the efforts of Antonia and Dimitrios Trichopoulos, and with aims being to share expertise in the area of health research and disseminate sound health-related knowledge, and there are several projects run under the umbrella of HHF, the Hydria project, the Credit for Health, Chances, and other projects also. Now, the underlying idea for Chances, for the proposal made by Chances, is aging, has to do with aging. Westendorp in 2006 stated that in the years to come, addressing the cumulative damage associated with aging will be one of the biggest challenges faced by industrialized countries. This was further confirmed by WHO and United Nations in their reports about aging. So aging is a process, starts from conception through death, and it is throughout the lifespan with marked physiological and performance changes occurring for some reason after the age of 60 years, and this is why in many studies elderly are defined using this cutoff point. Now that it's true that people live longer, the question is, do they live longer well or poorly? And this brings us to the idea of aging well, which has been very important for the European Commission programs. And what is healthy aging? According to WHO, it's avoiding disease, engagement with life, maintaining high cognitive and physical function, so a lot of dimensions being involved in healthy aging. So we talk about avoiding disease, prevention, identification of risk factors, modification of lifestyle habits, identification of biological mechanisms, and personalized medicine, which again is a very important issue nowadays. There have been cohort studies that are devoted to aging and healthy aging all over the world, Europe, USA, Canada, Australia, the WHO SAGE study, the in-depth study focusing on developing countries. And naturally, all these studies and their published results differ with respect to selection criteria and power, assessment of risk factors and outcomes, and statistical analysis. So another idea would be to try to collect already selected data within these cohorts and centralize them in order to increase power and in order to increase the accuracy in estimation of even well-known associations. And this was how Chances was set up as a collaboration of many prospective studies in Europe and USA with the focus healthy aging. The endpoints of interest in chances have to do with the morbidity and mortality in this age group, and I mention here specifically cardiovascular diseases, type 2 diabetes mellitus, cancer, fractures, and cognitive function, but also frailty and disability assessed with DALYs and QALYs. Risk factors for which available data exist in chances are socio-demographic and lifestyle, but also biomarkers and genetic profiles and others also. And I would like to mention 3 more deliverables which were undertaken within chances. First one is a questionnaire assessing the health of European elders. This is the health module that was created within chances. An Alzheimer's disease registry that was made in UMA, where relevant data exist in detail and biological samples also, and a feasibility study in Denmark for patients with prostate cancer. I will talk in a minute a little bit more about this. A lot of cohort studies participate in chances. You can see a visual inspection here, and more specifically here, and you can see European cohorts participating in chances, including Eastern European cohorts, as well as, of course, 2 large studies in USA. And this is an advantage of this project. A lot of people, more than 1 million, for whom data are available, with 125,000 deaths having occurred so far. And you probably can imagine the nightmare of synthesizing this data, but we're lucky enough to be successful. We have an e-publication describing the whole process as well as the rules under which the harmonized data were created, and we like to call this procedure meta-standardization or meta-harmonization, in a sense that the individual already harmonized data were meta-harmonized according to rules pre-set up by Chances Consortium. And the procedure then was groups of scientists within Chances. They set up specific hypotheses to be studied, and protocols for this hypothesis were submitted to the Chances Publication Committee, and the analysis was undertaken. And most of our results are based on meta-analysis of this meta-harmonized data in order, of course, to take into account the heterogeneity between the studies. In the next 3 slides, I will try to give you a brief idea of what has been published, major publications, of course, in Chances so far, but there are more to come. So you can see the first 2 publications are on a very well-established risk factor, smoking and CVD mortality and all-cause mortality. And you can see here the large number of people analyzed and events we had in Chances, and showing these 2 studies, the well-established association between smoking and CVD mortality and all-cause mortality, with the message being it's never too late to quit smoking. Another lifestyle factor here, diet, assessed through WHO Healthy Diet Index, and showing that adherence to an additional WHO guideline is associated with a 10% reduced mortality, or otherwise stated 2 years increased life expectancy for people at the age of 60. And publication, now with endpoint being the hip fracture incidence, and examining its association with education, marital status, and again, what we're seeing here is education, higher education is good for the risk of hip fracture, whereas living alone versus being married or cohabiting is bad, in a sense that it's associated with a 20% increased hip fracture risk. From biomarkers, there was a great interest in the vitamin D. We have 2 publications, one with endpoint being mortality, the other one with cancer incidence, and again the positive association of lowest versus highest quintiles of vitamin D with mortality was seen in one publication, and no association was seen with respect to cancer incidence. Here we have another publication examining both BMI and C-reactive protein, with endpoint being CVD incidence and mortality. What was seen here is a slight reduction in mortality for people, elderly people who are overweight, and of course increased mortality associated with increased SERP. For Alzheimer's disease, which has attracted a lot of interest within chances, so far we have studies that they have been based on local data, that is individual cohort data. Here is a publication coming from the UMEO cohort study, a case control study you can see here, which again showed something that has been out in the literature also, that infection with herpes simplex virus increases the risk of Alzheimer's disease. And then we have two more publications by the Greek, based on Greek data of chances, cognitive impairment being the exposure, mortality being the outcome, and as you can see here, 2-point MMSE decrease was associated with increased risk of overall mortality, CVD, and cancer mortality also. And the last publication showing what we have seen again in the literature, the association of Mediterranean diet with respect to cognitive impairment. And I would like also to show you the publication that came out, one of the two, the other one is in the pipeline now, it will be published very soon, from the intervention trial on prostate cancer patients undertaken in Denmark, intervention being a lifestyle intervention, including a health-promoting diet with high intake of whole grain rye, combined with high level of vigorous activity. And you can see here that the publication has to do with the spouses of these patients, what impact had to their lives the fact that they have been diagnosed with prostate cancer and the fact that they participated in this intervention program. Dissemination of knowledge within chances was intense, and this is the last dissemination workshop that was realized in Athens in 2015. And this is upon termination of chances. It was quite a big event, attracted the interest of the media. Health journalists were there, and you can see a lot of action in the rooms as well as outside the rooms. But let me now go back to the beginning of the Chances project. Here is the kickoff meeting of Chances in 2010, and you can see here in outside the rooms, the discussion were made. The one who is not here with us today, Dimitrios, making jokes with the people, interfering with them, and of course being there in the writing of the proposal of Chances, because as Elio said before, there was great interest by him and Antonia for aging and healthy aging. And yes, this has started a long time ago. Elio showed you a meeting of Epic Elderly. Here we are in 2006 in Umeå, in Sweden, and of course we are all younger there, but most importantly, Dimitrios was with us at that time. So let me finish this presentation. What is healthy aging in the 21st century? Again, as Wedendorp said, aging is best explained as the balance between investments in fitness and investments in body maintenance. Increasing our understanding of the aging process and applying available interventions will greatly enhance healthy aging, which, according to Baroness in 2008, involves coordinated efforts by the individual, the clinical and public health communities, as well as the policy enterprise. And this is exactly what was emphasized in the last workshop of Chances by Paolo Boffetta and Antonia Trichopoulos, that the results of Chances can be used to shape the agenda of European public health policy for the elderly in order to treat the elderly persons as equal, active partners, yet at the same time recognize their special needs and offer them a good quality of life. Or otherwise, as Dimitrios used to say, we have to promote healthy aging for the elderly and for those who take care of them. And with this, I would like to thank you very much for being here and for your attention.